Joining us now, Dr. Omer Awan, a physician and senior public health contributor for Forbes. Thanks so much, Doctor, for being here with us. Meg just laid out what's at stake here, what some of the controversy is all about. What are your thoughts on this current situation?
I think it's deeply troubling, Jessica, and particularly because of the panel that exists. Secretary Kennedy has selected and handpicked certain individuals, many of whom have spoken out against vaccines, many of whom share the same anti-vaccine ideologies as himself. And this is going to have major and profound influences for the American people because these individuals help approve new vaccines and they have the opportunity and the power to change childhood vaccination schedules as well. And they have the opportunity to decrease the amount of childhood vaccines that our kids get. And if that happens, that can open the door for very serious pediatric infectious diseases to spread, things like measles, for example, the flu, whooping cough, which is already a problem, as we all know, here in America.
And ostensibly, the reason they're looking into this is because they want to make sure that this is safe and necessary. Robert F. Kennedy and others have falsely tried to link autism to vaccines. There is no evidence that supports that. But what is the risk of kind of shaking people's faith in this vaccine schedule?
This is precisely the heart of the problem, Jessica, because what they're investigating, things like thimerosal, which Meg alluded to earlier, these have already been proven to be safe and effective. I mean, decades of research has already shown that the amount of thimerosal that are in, a small amount of flu vaccines that currently exist here in America are completely safe. The FDA has also said that these are safe. So, investigating these type of things that we already know are safe just casts doubts in vaccines. Remember, the average American is not Peter Hotez. The average American may not understand the subtle nuances of what makes a vaccine safe and effective. So when the average American starts to hear that these things are being investigated in vaccines, it naturally casts doubt. And what will happen is that this undermines public confidence in vaccines, and this will fuel vaccine hesitancy. And many less people and many less Americans will continue to not vaccinate themselves and their children.
Well, and as we all know and certainly learned during COVID, but vaccines really work best when everyone's using them. When you have a high vaccination rate is when they really can be the most effective. So you also run the risk of maybe people are still vaccinating their kids, but a higher number of people have stopped vaccinating their kids, and that can also make a difference.
It can absolutely make a difference. And, what you're alluding to also is herd immunity. When you vaccinate yourself, you're protecting not only yourself, but also those around you who may not be able to protect themselves. And this has precisely been the problem with measles. Now, herd immunity rates have decreased below 95%, which is a threshold to keep people safe. And what has happened? Now we have over 1,200 cases of measles here in America. 2 kids have died, and these are entirely preventable. These children didn't need to die. We've had 250 pediatric deaths from the flu this year because, less and less parents are deciding to vaccinate their children. And I fear and I'm very scared that this is going to be amplified given what we're seeing at the ACIP, given what Secretary Kennedy is saying, and given what his panel is promoting in the future.
And I'm thinking about parents out there, and look, it's 1:27 here on the East Coast. Maybe somebody's up for a midnight feeding. Maybe they're up on the West Coast and they just put their kids to bed. We don't know. But there are a lot of parents out there that just want to do the right thing for their kid, and they want to make sure that child is safe. And what would you tell them if that's what they really are trying to get at? If they want to make sure that child is as safe as possible, what's your advice to them as we kind of navigate all of this?
I would say a couple of things, Jessica. One is to get vaccinated. Vaccines save lives. I mean, these childhood vaccinations have saved more than 154 million lives. This is what research has shown. This is not just numbers that I'm making up. Many peer-reviewed papers have discussed this. The other is listen to your pediatrician. I think your pediatrician and your personal doctor has your child's best interest at stake. So, do the research yourself and listen to your physician and go with their recommendations. I think, if parents do that, I think, their kids will be much more safe, and it'll safeguard the health of them and many Americans.
And so what is your biggest, I think that's great advice, and hopefully everyone's able to navigate this safely and everyone stays healthy. What is your biggest concern as we look ahead, and this is all kind of being set up with this panel? Again, there's at least 2 people on the panel that have testified against vaccines during trials. So there is some concern that perhaps, they're not the most unbiased group of people. What are you most concerned about?
I'm most concerned that this sets up a perfect storm for misinformation to spread rapidly in America. I think it's very easy when you have panelists like this that are promoting these anti-vaccine ideologies and ideas. It's very easy for misinformation to travel very rapidly, and then people start to believe these things because people don't know any better. They're fed all of these ideas about vaccines. It's been highly politicized. It's a very polarizing topic, of course, now in America. And when people don't have, that level of health literacy, and it's okay not to have that, but it's also important just to do research and just to, find out for yourself, talk to experts, really assess the situation from both sides. But this misinformation has the potential to cost lives. And that's exactly what's happening now. People are dying. Kids are dying because they're not getting vaccinated. And I think the proof is in the numbers. I mean, the data doesn't lie. So very important for us to fight this epidemic of misinformation that currently exists.
All right, Dr. Omer Awan, thank you so much for your time. We really appreciate it.
My pleasure. Thanks.
An American